The side lying breathing drill is going to be laying on your side on your bed or on the floor, preferably your bed because it's a little bit softer. And you may find this is more accessible to you if the seated breathing drills don't feel great. I like to take something to put here in this little indented portion of my side to just give myself a little bit of support and to help me come into more of a neutral spine position. So you'll come onto your side and you can put your hand on your head or you can use a pillow. And then I'm just going to think big inhale, feel my ribs expand, and then exhale to release. I like to put my hand on the top rib cage so I could feel it expand a little bit more. Give myself some of that external feedback, and then I can also exhale to lift up and in. If you're having a hard time feeling the pelvic floor move, or maybe you're not feeling your back expand at all, we can come into a little bit of a rounded position. So you can bring your rib cage a little bit behind, and then again, put my hand here on my rib cage. I'm gonna think inhale. I should be feeling my ribs expand upwards, like towards the ceiling from the side. I should feel them expand backwards, and then I should feel my pelvic floor moving down. And then I can either exhale to relax, or I can exhale to engage. And sometimes the bottom prop that you have can give you some feedback against this side rib as well, in addition to the hand up here. But typically we're going to be focusing most on what is on top, feeling that back expand, feeling the pelvic floor load and lengthen. So you can do a few breaths on this side, and then I can switch to do a few breaths on the other side. The next thing we can do is we can bring a shift to the pelvis in the side lying position, which is going to bring some asymmetry to the pelvic floor and stretch different portions of it. So if we're having feelings of heaviness, for example, it could be because certain quadrants of the pelvic floor are fairly tight, usually the back left half. And so we're going to use a long pillow, just a normal sized pillow would be fine, and you're going to put it between your knees and your ankles. So you can come into your side lying position. I have the pillow between my knees and my ankles, and then what I'm going to think is this top knee, I'm going to shift backwards. So right now they're stacked, and then I'm going to think drive this femur back so that the leg is now sitting behind the knee. And so from here, I'm in a shifted pelvic position, and I'm going to feel it more in this top hip pocket. I can find my little bit of rounding, and then big inhale, exhale, release. Inhale, exhale, engage. So in the side lying breathing drill, we can first start with the knees stacked with one another. I can put my hand on my ribs, and then I'm going to think big inhale, exhale to release or to engage, where I'm focusing on feeling my ribs expand laterally, my back expanding, and then my pelvic floor loading and lengthening downwards in this position. So if you're not quite feeling the back or the pelvic floor moving, just find a little bit of rounding in the back. Almost think like push your chest away from the front side. Then we can bring some asymmetries to the pelvis, which is going to change the tension in the pelvic floor and target different quadrants of it. So the top knee, I would think drive back into that hip so that the top knee is about like 2 or 3 inches behind the bottom knee, and you're almost going to roll back to like a 40-degree angle. And then from here, same thing. I would think big inhale, exhale to release or to contract. Big inhale. So we have different options with the side lying breathing drill, and you may find this is more accessible to you if being seated on the pelvic floor of the perineum is pretty uncomfortable.